Well, our group is rather unique in that we have multiple disciplines within our private practice. So in addition to the clinical aspect, we have infusion services. We also have imaging services. So when it comes to anti-amyloid infusion therapy, one has to be mindful first and foremost regarding the safety of the patient. So we all know that the major risk side effect profile from this group of drugs is ARIA-E, meaning amyloid-related imaging abnormality edema, and ARIA-H, amyloid-related imaging abnormality hemorrhage. So one has to be very in sync with imaging because one must make sure that any patient who is a candidate for this treatment will have access to MRI scanning. So fortunately in our group we have those resources. So that's the first issue at hand. One has to be very coordinative in the usage of these agents because you have to be in close sync with your imaging division and also your infusion division. You want to make sure that as patients reach their point of requiring imaging, that the infusion department will get that information after it's been read by one of the treating neurologists. So all three gears, clinical, imaging, infusion, have to work in sync for the train to move forward, so to speak. So luckily, with a lot of hard work, our group has these capabilities so that when we initiate a patient on anti-amyloid infusion therapy, not only do we have the clinical capability to make the diagnosis, to make a diagnosis of Alzheimer's disease, to get the imaging PET scan or CSF, which is required for the confirmation of amyloid beta. But then we have the capability to make sure that that patient can travel down that train track of treatment with follow-up imaging to make sure there is no emergence of ARIA, and to coordinate all of that with our infusion centers, with experienced infusion nurses who know how to look out for side effects, infusion-related reactions, hypersensitivity reactions, etc. So it requires a close coordination within a very defined space. Not all neurology practices can do this. Smaller groups cannot, probably. But by virtue of our size, we are able to accomplish all of those components in a very seamless fashion so that the patient treatment can proceed in an unencumbered way and in a seamless and in a very coordinated way.